Hi there, it's Jessica Martin with Martin Management. Thank you so much for tuning in today to view this webinar. Let's just get started. All right, so the title is Address Dental Anxiety and Grow Your Practice. So I want you to take some time to just imagine what it would be like if your practice had more new patients than you really could even handle, right? Just full schedule, people calling constantly to switch to your office. What would that be like? I also want you to think about what would it be like for your practice if people just chose your office, right? They just wanted to come to you and you really didn't have to put a lot of marketing effort into it. No discounts, no giveaways, just that organic attraction to your office. And then I want you to imagine you receive recognition in your community as, doing something innovative, different that people are liking. What would that be like? And then lastly, thinking about production numbers climbing, and actually having, being able to work less but make more money. What would that be like? What could you do for your team, right? How could you bonus them? How could you give them more? How could you do more to give back to your community, and to philanthropic things that you're passionate about? What would that be like? So imagine those things, because that's what we're going to talk about today, is to get you there. So the things that we're going to go through today are, we're going to learn about why it is important to understand dental anxiety, because that's going to help grow the practice. You're going to gain simple strategies to put in place right away that will help your team address dental anxiety for your patients. And then lastly, you're going to learn how you could take it to the next level and really explode your practice. So a little bit about me. I've been married for 13 years to my husband, who happens to be a dentist. This is kind of how this all came about, Dr. Tony Martin. We have two beautiful children, Adriana, who is 7, and little Bennett, who is turning 4 here this time of year, which is great. And then we have our little pup, Allie, who is 16 years old. She has been with us since the beginning. So that is my family. And we live in Wisconsin, and we live on a lake, and we just love all that lake life has to offer, with all the recreation and just being outside and whatnot. My background is actually in school psychology. So I have a master's degree and a educational specialist degree in school psychology. So I really have a great understanding of sensory overstimulation, mostly with children who are struggling in the school setting, but we'll get to that. I also have a school counseling certificate, so I can be a school counselor in a school setting. And I also have my administrative license. I kept kind of getting pulled into leadership positions when I worked in the schools. And so I worked as an administrator for 5 years as well. And then my husband, alongside of all of this, has owned Martin Dental for the last 9 years. And I've helped here and there with, behind the scenes payroll and marketing and things like that. But really got heavily involved about 5 years ago into the dental practice. And then Martin Management has come about since then as well, because I want to share what we've learned with other practices to help them be more successful. So why should we be concerned about the patient experience? Well, there are so many people that truly dislike dentistry that psychologists really don't even know how to quantify it. And I loved this because in my background as a school psychologist, a lot of my job was to do assessment and to measure things. And so all of these scales and tests were developed to try to measure dental anxiety, or to understand it essentially a little bit better. And I just thought it was kind of funny. I don't know that anybody really uses this in their dental practice, but it shows you that this is obviously a real situation. More statistics, it's hard to really find a clear answer on this, but really it's estimated that over 60% of people have some form of dental anxiety. Most people, you could poll all of your patients and you'd probably only find like a handful or maybe 20 that are like, oh, I love coming. I love getting my teeth cleaned. They just love the feeling of whatever. But most people, even well over 60%, don't really care for it. They just go because they know they should, and they don't have like anxiety per se, but they don't really like it usually. What is the dental anxiety epidemic costing us, right? What is it costing the dental industry? It's estimated that's billions, because people are declining treatment that they need, and they're just putting off care. They're not coming in for maintenance and things. So it does cost the dental world a lot of money. And then that really, brings it back down to you. Like, what could this cost your practice? People, maybe if they're not keeping those cleaning appointments, they're canceling last minute, they're just not scheduling them. Your treatment plan, case acceptance, how is that? That could be affected by dental anxiety. Just the amount of patients that you have in general. And then obviously the more patients that you have, the more patients can refer their friends and family to your office. And that obviously then all affects production numbers. So what does this look like? There's a dental fear cycle that I like to teach people about, because I think this is a huge root of the problem. So let's start at the very top. Let's start at the top left, where we start with negative oral health experiences. So usually with people with the dental anxiety, that's what happens, right? They have some sort of negative experience, whether it was when they were a child and they were maybe held down or something really hurt, or maybe as an adult they had a really painful procedure. Whatever it was, created this negative experience, which then turns into some form of anxiety about going to the dentist, which then causes them to avoid going to the dentist. They don't want to pay for something they don't care for. And then in avoiding going to the dentist, they actually then now have poor oral health, which then leads them back into another negative oral experience, because when they put off care and their health deteriorates, now the what they come in for is probably going to be a little more invasive, which might be more uncomfortable, might cost more money, all of those things. And now the loop keeps spinning, and we need to really break into that. And we'll talk about how we can do that today. So this is what I love, because this is where my husband's profession and my profession really collide. Why do people hate going to the dentist? There are so many reasons. Like I said, childhood traumas, people don't like pain. A lot of people don't like the feeling of vulnerability that they have in the dental chair. They just don't feel like they have any control of the situation. And then my favorite part, which is the attack on the sensory system. I'll get into that in more depth, but these are just a number of things that could be going on for why people don't like going to the dentist. It's really helpful for you to know why. Just that alone for patients, having you understand or your team understand why it is they maybe don't like being there will really help everything, right? It helps how your team interacts with them. It helps them to feel understood. So just even knowing these things for each individual patient can be helpful in itself. So culture and things aren't helping us much. These are just funnies that it was very easy to find on Google. Just the way that our society depicts dentistry. I mean, it sort of like perpetuates the idea that it's a scary thing, that you shouldn't want to go. All these terrible things are going to happen. It's for sure going to be painful. And so I just think these are kind of funny. But I mean, unfortunately, some of our patients have these visions in their head of this is what dentistry is. And then there's the media, who I didn't even realize. I mean, I knew Root Cause was out there, but I didn't realize these other two movies even existed. But obviously really making dentistry into a scary, scary thing for people. So we can't obviously change the media overnight. We can't change society's perception of dentistry overnight. I'm hoping with what I'm offering and, changing each office by office, we can change the overall societal perception of dentistry. But let's start smaller, right? Let's start with your office. So what can we change? There are a lot of things we can do a little bit differently that will make a difference. So let's get into that. So as I mentioned before, one of the main things that I have found that is off-putting about dentistry, it relates to the sensory system. So our sensory system is in our body so that we can determine if things are positive or negative psychologically. So we all know what the five main senses are: smell, sight, touch, hearing, and taste. And again, those are built in so that they help us judge. Oh, I don't like that smell, so this might be dangerous, right? I mean, evolutionarily speaking, these were put in place for life or death kinds of situations. But now they're just there to let us know if something's pleasing or something's not pleasing, right? So these are important in the dental experience. So like I said, in 17 years of working in the field of psychology, I really realized the dislike of dentistry is largely about the senses. And everybody has different sensory tolerances. So, I mean, I used to work with kids that were on the autism spectrum, and their sensory tolerances were much different than a typically functioning person without autism, right? But we all have varying degrees of sensory things that we'll tolerate. So for some people, for example, they just need to have clean hands. Like, it really bothers them to have anything gooey on their hands, or to, just to have hands that they feel like aren't clean. People that really worry about germs a lot, they just need to kind of clean their hands a lot. That's okay. Some people need to start or end their day with a shower. For example, they just don't feel quite right, or right, like they're able to take on the day, or maybe it's sleeping without that shower, right? That is a sensory tolerance. That's something that the person has realized that they need, and they're able to function with that just fine. But those are things they build into their life to be more successful. And then obviously there's dislikes of certain sounds. Most of us dislike the sound of nails on a chalkboard. The sound of a baby crying is very off-putting for a lot of people, especially new parents. So these are things that like everybody kind of deals with on a certain level. And unfortunately, dentistry actually assaults the sensory system from almost every angle. So I just pulled this picture of a dental office online just to kind of give you a visual. And we're going to talk about the different sensory experiences that are there and when the person's in the dental chair. So the first thing, actually, before they even get to the dental chair, is the smell of the dental office. I can remember when I worked in the school setting and I would just go and visit my husband's practice, I would walk in, and I'm not even that sensitive to scent, but I would literally walk in and feel like I was hitting a wall of the smell of dentistry. And I can remember it. And I disliked that. And I'm not, like I said, I'm not very sensitive to scent, but that was off-putting to me. Now, if you work in a dental office, you can't even smell this, more than likely, because you're just accustomed to it. But for your patients that are there every so often, that is a wall of dentistry that is right off the gates off-putting. There are obviously a lot of different noises in the dental office, right? So there's the sound of the drill, there's the suction, there's the ultrasonic cleaners. I mean, there's lots of little noises that can be alarming to people, especially for kids, because they don't understand what those noises mean and whatnot. There's also the sight of the dental instruments, right? So they see a tray of all these things that are pokey, and they wonder, where's that going to go? That looks like it could hurt. That looks, just the seeing those instruments can be off-putting. Obviously, we have needles in this industry, so seeing the needle can be off-putting. Just clutter in general causes people to not feel as calm. The dental office, the typical dental office, is pretty clinical looking. It's hard to make it look too much unlike a dental office, right? There's certain equipment that just needs to be there. So that clinical looking environment can be off-putting. Touch. So people don't, like I said, like they don't like fear, or they don't like to be put into pain. So if the touch that the dentist has to do the procedure is painful, that's obviously not something that they're going to enjoy. Again, feeling vulnerable, even having the chair laid back without, their knowledge of like, hey, we're going to lay the chair back now, can really cause the sensory system to go up in arms with that feeling of vulnerability, and just someone being taking their control, and even just the touching can be off-putting. And then there's different tastes, right? So there's unpleasant topicals, prophy paste, things that we have to put in people's mouths that don't taste great. And then a lot of people don't like being numb, and they have tooth sensitivity. So that causes them to feel more anxious because their teeth are already sensitive, and then you're going to be poking and prodding, and they're going to be more sensitive. For kids especially, there's a lot of other things to think about with texture, bright lights, masks that we wear, and then noises and things are pretty alarming for a lot of kids. So those are just some examples. I don't want to go into too much depth on the sensory experience of the typical dental visit. So what can we do about that, right? Well, the first thing relates to the ambiance. So in your treatment rooms, you can do everything possible to reduce clutter. You can choose colors that are more calming, that are less sterile looking, less clinical looking. And then I like even having curtains in the treatment room. It really just warms it up, makes it feel more homey and less clinical in general. And then there's things we can do that I like to call patient comforts that really help the patient to feel more, I guess, taken care of and put them at ease. So some really simple things that are low budget would be like offering blankets, because the offices often are cold. Neck or knee pillows are really great too, just to make sure they're comfortable in the chair, especially if they're going to be there for any length of time. Adjusting the chair, asking like, hey, how are you? Are you comfortable? Is there anything I can do to help you feel more comfortable? Those kind of things can go a long way. And then obviously, if you have the option to offer some distractions, that's great. So whether that's music, whether that's television, things that really can help the patient take their mind off where they are and what's going to happen are helpful. Some other things that can be helpful right upon intake. So scheduling the new patient. So, doing as much legwork as the team can up front to gather insurance information, to get images from a previous office, to let the patient really fully understand what the expectations are. So is payment due the day of service? Is how long will they be expected to be there? Who will they meet? Those kind of things really can help set up the patient to feel more comfortable when they arrive, and so that they're not having to fill out a ton of paperwork, right when they get there as a new patient, and they're maybe already anxious. So if they can get a lot of that done on the front end, they can arrive and really just start to, calmly enter the experience without all that extra stuff. I do recommend offices consider a full hour comprehensive exam with the doctor. And I understand this is a lot of time and that it isn't necessarily cost effective, if you will, on the front end. It's not. What you're charging in that comp exam isn't what you could charge for a similar service that could be done in that hour. However, I argue that the time put into this comprehensive exam, this new patient experience, will pay dividends in the long run on treatment planning later, those case acceptance things, just on the solidity of the rapport built with that patient and understanding them and really going through a good medical history. Those things will go a long way with loyalty, rapport building, referrals, all those other things that you're going to want down the line. So I do stand by that. And then comfort questionnaire. So this is something I developed, and I'll get further into other things that you can do that are taking it to the next level. But a comfort questionnaire really dives into understanding where the patient's at in terms of their psyche. So that kind of goes into the next part of the slide. So have they had a past trauma? Have they, how comfortable are they? Do they know what triggers them if they have a trigger? Asking, just understanding how you might be able to help as a team, really, like I said, can go a long way in that new patient experience. So here's where we talk about taking it to the next level, because those are really simple things that I think every office should do, but there are additional things that will give you amazing results. And that's really what Martin Management is all about and what I offer. So let's get into that. I call it being a dental spa. There's a lot of offices saying they're dental spas, but they're really not doing much psychologically speaking. They're just doing a little bit of pampering, maybe offering massage after a visit or something, but they're not altering the patient experience while the patient's in the dental chair, unfortunately. That's where we're missing the boat here. So what does this look like? So on the far left of the slide here is a checklist of pampering, or I call them spa amenity items, that the patient can choose from that are proven to calm the sensory system. So they feel like just little pampering things, but what each thing will do is have a part in calming that sensory system. So they're great. They're optional. So if a patient doesn't like, the thought of pampering or having a neck wrap on or whatever, they don't have to do that, but they're there. And the more the patient understands why they're important, the more willing they're going to be to utilize them and then have them work really well. But anyway, the middle picture there just shows you some of the items that are on that list. A neck wrap that gets heated and placed on the shoulders. There's an eye mask that's actually cool to reduce puffiness, or some cucumbers that we can use to make it feel a little more pampering. But again, there's some visual components there with regarding not seeing instruments with this on, with regard not seeing hands and arms coming at them when treatment's ready to be done, things like that. And then on the far right, it shows a diffuser where you can diffuse essential oils to really take that dental smell out of the air. Here's some other examples of what this can look like. So on the far left, a blanket, obviously. There's a knee bolster there to just help with the comfort in the chair. The neck wrap is shown there again. And then if you're lucky enough to have heat and massage built into your dental chairs, or you need new dental chairs, talk to me, because I have a good connection with a rep that can basically give you the heat and the massage option for free, because we collaborate well together. That's obviously an added bonus. And then middle picture there is some hot towels, just help the patient clean up a little bit after treatment, just gives them that pampered feeling. And then on the far right are some noise reducing headphones that will really take the pitch of the high frequency pitch of the drill down, but still allow the doctor and the assistant or the hygienist to communicate with the patient effectively. So again, you're creating this space to relax, and you're avoiding the triggers that contribute to dental anxiety. I see, I do a lot of research, and I'll look online about dental anxiety, and it always talks about like what the patient can do to help with their dental anxiety. I really don't think that's the answer. I feel like it's our environment. What can we do to help with dental anxiety? And these are things that are easy to do, to be honest, in the scheme of things, right? So far left is just, an example of a treatment room. Middle part there is showing that, even when things come up, like you have a patient that is involved in a charity event and they want a little basket or a silent auction item, you can put together a little basket of spa kind of things, but also give it like the dental spin. So you can put some toothbrushes in there. We've got some chapstick in there. Really just to, it can really become like this kind of niche for your office to be kind of what you're known for, and really, really great. This is also a great way to, you're allowed to in your state, to get feedback from patients. So whether you're asking for like a Google review or a Facebook review or a Facebook check-in, you can do a monthly giveaway of something really small where people are going to start doing some of that organic marketing for you, which can be really helpful. And then the far right just shows some water, some fruit-infused water. So again, it just gives a kind of that spa vibe next to the diffuser in the waiting room, but it's really cost effective in a lot of ways. You're not buying bottled water. It gives that cool vibe, simple things. So what does all this do? Well, it creates value. It creates a demand for your office because it's something different that not everybody is doing regarding the experience. And I just gave you some little examples. There's more to the whole package than what I'm sharing, but I want to just give you a flavor of what this could look like. So really, I mean, like, I hope what we're doing with this is raising the standard of care, just making it a dental experience should be great, right? We should not dread going. And so what this will do, if you can do it right, is to create hype for your office and organic marketing. So we'll have patients that, they'll have like a neck wrap on and their knee pillow and their blanket, or they'll take a picture of the little comfort, a spa amenity checklist, and be like, I'm at the dentist, look what I'm getting. And they'll put that on Facebook or Instagram. And then people are like, where are you? What is this? And boom, 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 boom. Now you've got this whole conversation going about your office and how amazing it is. And that will lead to more new patients. But even when a person's financial situation changes or their insurance changes, their job changes, you are now that place that they're going to want to go regardless of those situations. And they're willing to pay a little bit more because, again, that value is there. They can't get that down the street. So they're going to be willing to pay more to stay with you because you're doing something amazing for them. So this is what I love doing. And I think it's really just a great side effect, that the business grows along with this, because I think ultimately it's about, helping the patients psychologically. That's kind of how this started for me. I was like, do I do some counseling for patients with anxiety before they get treatment? That didn't seem like the most effective thing to do. So anyway, that's sort of how this has come about. But those great side effects are that the business will grow too, which is, I think, a win-win for everybody. So something to think about, in terms of patient retention and gaining patients, in terms of how to keep patients, it's really important to understand what attracted the patient to your office to begin with. So here's a list of ways that a patient might come to your office. So they might have come because a friend or an acquaintance had referred them, or maybe they're your friend or acquaintance. And then the next option is they're referred from a trusted individual. And then the next option is it was experience driven. They heard it was great. They heard it was painless. They heard there was pampering involved for nothing extra on their part. And they're like, that sounds good. Those three ways are going to be your best ways to get new patients because they're easier to keep. If you've utilized any of the last three ways, they're harder to keep. It's just how it is. Insurance driven, when their insurance changes, they're going to choose a new office. If your office is just where they've always gone, they're going to hear about something new or exciting down the road. I mean, people are just less loyal. Consumerism has changed. And so that's not as great of a way as it used to be to just keep patients. And then, or you offer a discount or promotion, right? That's maybe a way to get people in. The volume is there of new patients, but when the next office offers some new discount or promotion, they're going to be looking for that. You're going to always have to keep up with that. And that can obviously reduce the quality of dentistry you can provide. So I want you to become the place. What's cool about this is that relaxed patients are just better patients. They accept treatment more readily. They more readily refer friends and family. They're more loyal in general, and they're easier to do treatment on and even get numb. And this was something I did not anticipate because I'm not a clinician, but my husband started reporting, my gosh, I feel like I'm getting faster. People are just it's easier to get the block. It's easier to get way back there when I need to. And I think it's because the person isn't tense. When we're nervous, we kind of close our body off physically. When we're relaxed, we're open and we're more ready and able to receive treatment. And so it's easier to do. It's just really cool. So it can be an explosion of new patients and then obviously retention of those existing patients. The other thing that this is really does is it helps to attract ideal patients. So ideal patients are those that really value the quality of dentistry that you're doing. They're willing to pay for that. They're aesthetically driven, so they might want a whole new beautiful Hollywood smile. They might want things like Botox. They might want whitening. They might want ortho. They're just more aesthetically driven, and they tend to be more on the affluent side because they like those pampering things. That pampering atmosphere will attract those more affluent people. So you'll have higher case acceptance and you'll have higher end dentistry to do, which hopefully you like. You'll also attract patients that have put off care. So that will result in large cases, people that have, years of work to catch up on, unfortunately. It's interesting about this because my husband was nervous when I presented this idea back to him 5 years ago. Like, I really think this is the key to our marketing. And I also think this is going to help people, this whole dental spa thing. And he was like, I don't want to bring in a bunch of people that I have to counsel or that need to be sedated. He's licensed to do conscious sedation, but he's like, I don't love doing it. It takes longer. It's just, there's more moving parts. Anyway, we have noticed we definitely do conscious sedation at times, because there's some cases where it just needs to be done. However, we've noticed that the majority of people are willing and able to get through treatment without utilizing conscious sedation. They come to us thinking, I'm going to need that for sure. I've been putting this off for 20 years and I'm going to need to be sedated. Absolutely. And then we start to show them all the things that we can do to address the dental anxiety that they have. And they're like, I think I can do this. And I might not even need nitrous. So we were surprised by that, pleasantly surprised, because we didn't necessarily want a sedation practice. So here are some questions that offices will often ask me. So who does all these extra things for patients, all these amenities, you call them? Well, the doctor doesn't really do anything. They get off the hook here. They just get to come in and do dentistry on a really relaxed and happy patient. So we try to split this up. And I've created systems for all of this because it took about 2 years to perfect all the trial and error with this. And so we kind of split it up on the rest of the team. So the front office will do a little bit in terms of the intake and understanding, where the patient's coming in anxiety level wise, and then offering the amenities and things. And then the assistants and the hygienists will take on actually putting the amenities in place. And I'm telling you, these things take not even minutes. If everybody in your practice needed or wanted every amenity that I can teach your team how to do, it wouldn't add any time to the schedule. We have not had to add any treatment time to the schedule. And we've actually seen scheduling tighten up a little bit because, like I said, people are just so much more able and ready to receive treatment. And so I know time is of essence in the dental world and in our schedules in the day, and this doesn't impede on that, which is awesome. And that's why utilizing my systems as opposed to being like, oh, let's be a dental spa and let's throw a few things in, can make a huge difference with that. But anyway, I often get asked, what is the cost of offering these amenities to patients? Because I really do recommend that the patient not pay for any of these things. They're not a standalone service. We're not offering a foot rub or anything, right? We're offering little things that will help calm the sensory system while the patient's in the dental chair. So in terms of, if we look at like a 4 treatment room office where there's 1 doctor and 2 hygienists, on the low end, if you want to go low budget with this, we're talking about $200 in supplies. And if you want to go high end on this, like Bose noise canceling headphones, and you want hot towels in every treatment room, then you're looking at $1,000. But again, that's like so marginal in the scheme of, gaining new patients. I think it's kind of funny, but those are the numbers. And I've got everything itemized in terms of what you need, how many you need, where to get them, what they cost. All those details are ironed out in my programs because we don't have time. You don't have time to deal with all of that. And then, there's some things that are disposable, like the neck wraps will wear over time after they've been heated 1,000 times. So about every 6 months or so, you're going to look at another $50 just to keep things fresh. But again, really low budget in the scheme of the dental world. And then people often ask, how long does it take to get this rolling? So like I said, it took us 2 years to perfect all these systems and, what to use, how is it going to be disinfected? How do we build this into the schedule? All those things. And now I have offices that utilize my systems and they're up and running in 2 months and marketing themselves as a dental spa and addressing dental anxiety. And we're seeing those great returns. So very, very quickly with it systematized. So here are some other questions. And my quote is kind of covered there, but the quote is, we cannot become who we need to be by remaining what we are. We have to make little changes, right? But none of them are painful, I promise. So the focus is absolutely still on dentistry. That was my husband's number one concern when I brought this idea to him 5 years ago was, I don't want to be seen as some sort of voodoo doctor, or I don't want people to be confused. Is it a spa? Is it a dental office? Like, what is this? So absolutely the focus is still on dentistry. There are no logo changes needed. You don't need to change the name of your practice. You don't need to change your tagline. You don't need to do any of that. If you want to, that's fine, but you don't need to. Simple decor changes. A lot of people think, well, I don't want to redo my whole office. I don't have the budget for that. You don't have to. Again, it's some simple things I can recommend that will go a long way in terms of how it feels aesthetically and whatnot. Really what this is an innovative way to stand out and grow your practice. It's so hard to compete marketing wise with all the dental practices that are out there. I don't know if you feel that. I know we did. And this is a way to really stand out very effortlessly. So think of it that way in terms of marketing. You're going to create that value to retain those existing patients and then obviously get all those new patients that are going to be attracted to that. And then you're going to have really small changes that are going to yield huge impacts. So these are the results from our office, and I'm happy to share. So for Martin Dental, we have quadrupled our new patient monthly averages. We have increased yearly production by over $400,000 consistently. And this year, I think we're going to be even another 200 over that, just the way things are going. We've received the award in our community as best dental practice 4 years in a row. And again, it's just my husband is the only doctor and we have 2 hygienists. So we have a really tiny team. And we're competing with offices with over 6 doctors, so just the volume of patients alone that are voting, because this is like a community voted contest. It's just crazy to me that we can even win this, but we do because we're doing something different that patients really appreciate. So that's pretty cool. We have a full schedule, right? So that's beautiful. That's production. The schedule is full. We have large waiting lists for holes. So when someone is sick or whatnot and needs to cancel, we have got a list of people we can call to move in so that schedule stays full, which is a huge, huge thing. We have a calmer workplace. And this is another side effect I didn't really anticipate, but it's just like when you're pampering people and you're helping them to feel calm and relaxed in the dental chair, you kind of have to take that on too. And it's not like a training thing. It just becomes what it is. And when your patients are calmer and more relaxed, you tend to be also. Like it's just like a catch-22. So we didn't anticipate that our office dynamic would feel better and it would feel more like a better place to be, but it does. And we have also noticed our staff retention. We haven't lost anybody. No one's quit since we started this. I think people are just excited that they're working for a place that's doing something different, that's doing great things for patients, and it's a nice place to be. And then patient retention. Our patient retention was always pretty good, but we don't see people leave. It's just, if they move far, far away or something like that, that happens. But we were even able to raise fees by about 10% across the board. And again, people have stuck it out. So that's pretty amazing result wise. So if any of this has resonated with you and you're like, hey, I want to do this where I live and with my practice, I would love to be a part of that. I do have a special offer for people that are viewing the webinar. So if you would like to receive the Create a Dental Team That Thrives webinar, part 1 and 2, for free, I'm happy to send that off to you. So just contact me and let me know you saw the webinar and you'd like that webinar as well. It's a great way to just, again, create a great dynamic with your team. Doesn't really have anything to do with the dental spa approach, but I think it's still very valuable. And then their discovery call. So the first step is usually finding time to just chat a little bit about what is your practice like, what are the goals, what are you hoping to achieve, and just to see if this might be a good fit for you. And if you're willing to book the call from the webinar, so contact me, say, hey, I saw the webinar and I'd love to schedule a discovery call. Then if you are to book one of the programs that I offer, then you'd have 10% off those programs. So that's a pretty great deal as well. So I'd like to end with this quote because I think it's just fits with everything. So some entrepreneurs think, how can I make a lot of money? But the better way to think is, how can I make people's lives a lot better? If you get it right, the money will come. So let's do right by people and we're going to see our businesses grow. So I appreciate your time so very much. It is truly my mission to help as many offices as I can to do dentistry better. So I would love to help your team make your office even more amazing. And these are the ways to contact me. There's my email, there's my phone number, and then my website is there too if you just want to kind of do your own research and see what that's all about. Also, at bare minimum, please follow me on Facebook or LinkedIn. I'm constantly putting up tips and just little things to help improve your office. So even if the dental spa approach maybe isn't the right fit or it's not the right time right now, follow along on those platforms and you'll gain something for sure. So thank you so much. And I hope to meet you soon.